Hi, it's Dr. Springer. We're going to talk a little bit today about gastrointestinal disorders. And when we talk about that subject, there's a whole host of different kinds of symptoms and different kinds of labels that have been attached to those symptoms. For example, we can talk about heartburn and GERD and indigestion. Those are sometimes terms that are used interchangeably to describe symptoms of usually distress or feelings in the upper gastrointestinal system. We have people who have experienced diarrhea or constipation, and unfortunately they think that that's really part of their daily life and it's kind of normal. It's not normal. It's a symptom that something is wrong with what's going on. And then we have more advanced conditions that can happen behind any of those, and things like IBS, IBD is another one that's sometimes used as a label, colitis, Crohn's disease, ulcerative colitis. So there's a whole host of things that can happen to the gastrointestinal system. And when people think about the gastrointestinal system and gastrointestinal disorders, they think about, okay, well, my stomach doesn't feel good, or I'm having trouble with elimination. But the reality is that your digestive system is much more than that. Yes, it's important for your assimilation of foods. So therefore, nutrients that you can absorb, both the macronutrients like your carbohydrates and proteins and fats, are very important to be able to have the digestive system working correctly to be able to absorb those. Otherwise, you can end up with a nutrient deficiency. But beyond what it supplies to us in terms of the nutrient issues, we also realize that 80% of your immune system is in your digestive system. Sometimes that's popularized by different yogurt commercials talking about that, but it's something we've been talking about here at LifeWorks for 20 plus years, how important the gut is relative to the entire digestive system, but also beyond that, how important it is for the overall immune system. And so therefore, when the digestive system is out of balance, the immune system is out of balance, and so therefore things like allergies and a whole host of other things can springboard off what's happening for us in our digestive system. In addition to that, some 80% of the serotonin, which is a neurotransmitter that's sometimes referred to as your feel-good, happy neurotransmitter, 80% of it outside the central nervous system is stored in the gut. It's also made by a protein called tryptophan. So it can give rise to things like depression and anxiety because of those particular neurotransmitters being deficient as a result of gastrointestinal issues. So when it comes to your digestive system, it is really core to understand that it goes way beyond just having some gas or having some bloating or having some distension or discomfort, which are all very important signs to pay attention to. But making sure that you understand that it ties into your immune system and also to how you may function from a mood type standpoint. The other thing that's important to know, and that we have the digestive systems always absorbed, everything from there goes to your liver. And so sometimes when you have absorption issues and are imbalances in the gastrointestinal system, it also can put additional stress on the liver. And the liver plays an important role in everything from hormone regulation to glucose metabolism to fat burning, and you begin to name it, the liver plays a major role. So when you talk about the gastrointestinal system and the disorders that can go with that, it really is a vital part of making sure you get that in order, make sure it's balanced, is an important part of maintaining your health. So stay tuned, we'll talk more about gastrointestinal systems in the future.